Hello everyone, my name is Sofia Marin and today we are going to talk about the topographic anatomy of the pleura, bronchi and lungs. So let's get started. Topography of the thoracic cavity, cavitas thoracis. There are two pleural cavities containing the lungs. Between them lies the mediastinum. The mediastinum is the part that contains the heart, the pericardium, large vessels, nerves, trachea, and primary bronchi, esophagus, thymus gland, and lymphatic vessels. So, all those structures are in here, in this mediastinum. We have two types of pleura. We have visceral pleura and parietal pleura. Visceral pleura is the one that covers the lung, and parietal pleura is the one that also covers the lung, but the difference between them is that visceral pleura is attached to the lung, so we cannot remove it without damaging the lung. And parietal pleura covers the lung, but there are some recesses that are not attached to the lung, so we can breathe in and breathe out without making friction with the thorax. So we have in here more pictures. We have the trachea, we have the mediastinum, we have the diaphragm. It separates in the right side the liver, and in the left side the spleen and the stomach. We have the parietal pleura outermost, we have visceral pleura innermost, we have pleural cavity between both of them, and the recesses that I was talking. There's the first one called costodiaphragmatic recess. As I said, pleura is a thin membrane that covers each lung. We have both three that we already talked about. And the pleural cavity, this one is fulfilled with fluid that is called pleural fluid. The innervation of the pleura is innervated by the intercostal and phrenic nerves. The visceral pleura is innervated by the rami of the pulmonary plexus. And in here is the ligamentum pulmonare that I was talking. Right here. This is the right lung. We have the apex of the lung. We have the ileum, that is this part. It contains the main bronchi, pulmonary lymph nodes. It contains the pulmonary veins that are red because they carry oxygenated blood. The ligamentum pulmonare that I was talking, inferior border, inferior lobe, superior lobe, and middle lobe. So we can determine, because it has 1, 2, and 3 lobes, that it's a right lung. We have also the cardiac impression that is in here because the heart is situated in this part. We have also the horizontal fissure and the fissura obliqua that we have in the right lung and in the left lung. We have a diaphragmatic surface. Pleura parietalis. The pleura parietal is composed by two parts, the external surface and the internal surface. The external surface faces with the fascia endothoracica. There is a small amount of subpleural cellular tissue, and in the internal surface it faces with the pleura visceralis, is covered by the mesothelium and is moistened by the small amount of serous fluid. That is the pleural fluid. So, parts of the parietal pleura. We have the cervical part, we have the costal part, because it faces with the ribs. We have the diaphragmatic part, and the mediastinal part because it faces with the mediastinum. As it in the right side and in the left side. And here we can see a more detailed picture. Cervical pleura, costal pleura, mediastinal pleura, diaphragmatic pleura. We have the left lung, we have the right lung, we have the main bronchi, we have the heart in the pericardium, we have trachea in here, and the diaphragma. So those are the subdivisions of the parietal pleura. Let's see in more detail the parts of it. The cervical pleura or cupula of pleura or cupula pleurae is connected by the cellular tissue with the membrana suprapleuralis, a part which separates the thoracic cavity from the organs of the neck. Pars costalis is the largest part of the parietal pleura, is intimately connected with the endothoracic fascia, cutting ribs and intercostal spaces from inside. Pars diaphragmatica, it involves the superior surface in the diaphragma, except for the median part where the diaphragma joins right to the pericardium, and the pars mediastinalis, it passes from the posterior surface of sternum to the lateral surface of the spinal column and adjoins laterally to the organs of mediastinum. The anterior limits of the parietal pleura that are in sky blue here, parietal limits, are situated asymmetrically at the left and right side because the heart pushes the left pleural fold aside. And here we have the heart. We have in here the heart, and it pushes the left lung. So it will be obviously like shorter, smaller than the right one. The right from the pleura cupula to the sternoclavicular joint and goes down behind the manubrium, descends to the level where the fifth rib cartilage attached to the sternum. From there it passes on as the inferior limit of the pleural cavity. And the left at the level of the fourth rib, it travels laterally, leaving the triangular area of the pericardium free of pleura, covering descends to the sixth rib, where it continues. As we see in here, like it goes from the apex through the manubrium, sternum, and then it goes laterally and ends in here. And the right, it goes like the apex, and it goes from the manubrium, from the sternum, from the cartilages, and then goes straight to the recessus in here, diaphragmaticus. The anterior limits of the parietal pleura. Also we have the superior area with the apex downward is situated behind the manubrium of sternum. The thymus gland attaches to this area. And in the inferior area, we have the half of the sternum and anterior parts of the fourth and fifth intercostal spaces attaching to it. In this area, the pericardium adjoins to the thoracic wall. In the inferior limits, we have like it go along to the mid-clavicular line upon the seventh rib, along the mid-axillary line upon the 10th rib, along the scapular line upon the 11th rib, along the paravertebral line of the 12th rib. On the left, the inferior limit of pleura lies a little lower than the right. The posterior limits descends from the pleura cupula along the spinal column and corresponds to the costovertebral joint. It adjoins to the esophagus. Let's continue our video. Yesterday I was feeling like a little bit sick and now I'm feeling better. So let's start with recessus pleuralis. They are places where the borders of the lung doesn't coincide with the pleura, and they can be just fulfilled in the deepest inhale. Even the costodiaphragmatic recess is like the deepest one, and it cannot be fulfilled even in the deepest breath. And the costomediastinal recess is the one that is next to the mediastinum. We are going to see here the costodiaphragmatic recess, anterior, posterior, and lateral view. We see that is like almost horizontal recess, and and the costomediastinal recess is the one from here, is next to the mediastinum, and it faces with the ribs, so it's costomediastinalis. And costodiaphragmatic because it faces also with the ribs and with the musculus phrenicus. The costodiaphragmatic recess. The costodiaphragmatic recess is the deepest between the mid-axillary and scapular lines. It is formed between the costal and diaphragmatic parts of the parietal pleura and is situated at the level where the diaphragm has a semicircle attached from the sixth rib to the spinal column. Posterior, the recess reaches the azygos vein on the right and on the aorta on the left. The lung don't feel the costodiaphragmatic recess, even the almost inhale. So we have in here costodiaphragmatic recess. Okay, the recessus pleuralis costomediastinalis. This recess is quite smaller on the right, while on the left is considerably larger. Recessus costomediastinalis is situated at the anterior limit of the pleura, while the costal part passes on as the mediastinal one. So, costomediastinalis recessus, as I said, kind of triangular one, smaller than the diaphragmatic, of course. And we can see in here that the margin of the lung and the pleura doesn't coincide at all. So, mid-clavicular line, it goes from the sixth rib, and the margin of the pleura in the mid-clavicular line will be the eighth rib. The landmark of the mid-clavicular line from the margin of the lung will be the eighth rib, and in the pleura will coincide the 10th rib. Mid-scapular line, the 10th rib, and margin of the pleura, 11th rib. We have in here some features that we have to understand. That is lobes, horizontal fissure, oblique fissure, impressions, ilium, lingula, cardiac notch, pulmonary ligament, bronchopulmonary segment. For me, the most difficult was lingular and cardiac notch. The others, like we already know, or maybe we saw in some lectures before. So cardiac notch will be the indentation for the heart in the left lung. The lingula is kind of tongue-shaped feature of the left lung, just left lung. Okay, the ilium is the part that contains the bronchus, main bronchus, artery, superior vein, and inferior vein. And bronchopulmonary segment, 10 functional segments in each lung supplied by the segmental bronchus and a segmental artery from the pulmonary artery, 10 segments on the right lung and 9 to 10 in the left lung, because it's quite smaller, because the heart is placed in this side. And we have the horizontal fissure that will be just in the right lung. And now let's start with the topography of the lungs. This is the basic summary of the lungs. Each lung is characterized by its apex and base. The apex projects the superior thoracic aperture and the base is placed on the diaphragm. This is the apex and this is the base. Base, apex, diaphragm. The lungs have three surfaces, three borders. The surfaces will be costal, medial, and diaphragmatic, and the borders anterior, posterior, and inferior. The organs are divided by fissures into lobes. The left lung has 2 lobes and 1 fissure. The right lung has 3 lobes and 2 fissures. The left lung will have the oblique fissure, and the right lung will have oblique and horizontal fissure. But this is the left lung. Okay, the lobes are divided into bronchopulmonary segments. The left has 9 to 10 and the right has 10. Between lobes are interlobular surfaces, of which are separated by fissures of the lungs. Skeletopic of the lungs. It has anterior, inferior, and posterior limit. The anterior, we have some quite differences between the right and the left lung. So the anterior limit of the right lung goes from the apex down along the medial line and at the 6th rib passes on as the inferior limit. And the anterior limit of the left lung, it circumflexes the heart at the level of 4th rib. It turns left to the parasternal line and turns downward in the 6th costal cartilage. The anterior limit of the left lung passes on us as the inferior one. The inferior limit along the midclavicular line, the superior border of the 7th rib along the anterior. The posterior limit totally repeat those of the pleura along the spinal cord. So we have the anterior limit will pass from the apex down and circumflexes the heart and then sharply goes to like this to the costo diaphragmatic recessus. Then goes the right lung, goes apex, midclavicular line, sternum, and then goes sharply. That's the anterior limit. And okay, surfaces of the lung. We have 3: medial, costal, diaphragmatic. The medial surface is part that faces the mediastinum, and it consists of the mediastinal and vertebral surfaces. The anterior mediastinal part, anterior aspect of the medial surface is identified by the concavity that accommodates the cardiac pressure. This is the cardiac impression. The posterior mediastinal part, they are next to the thoracic vertebra. The medial surface has the presence of the helium. So, kind of. Anterior mediastinal part, posterior mediastinal part. It has the helium, and in the helium we have some important structures that we are going to see in the next slides. Diaphragmatic surface or base. We have that the diaphragm separates the thoracic cavity to the abdominal cavity. In this place, in the right place will be the liver, and in the left will be the stomach with the esophagus, duodenum, stomach, and the spleen somewhere here. The part of the lung that rests on diaphragm. The left hemidiaphragm separates the base of the lung from the spleen and stomach, and the right hemidiaphragm separates the lung from the liver. The right lung has deeper basal concavity to accommodate the liver. Medially, at its origin, the borders appear round, then becomes thinner and sharper till the costodiaphragmatic recess. So it goes like this and then sharper downward. Costal surface is less remarkable than the medial surface. It is marked by the impressions of the overlying ribs and the groups of the respective fissures. So, those are the impressions of the ribs, and we have in the right lung we have the superior lobe, we have the middle lobe, and we have the inferior lobe. Those are the lobes, 3 in the right, and we have in the left lung superior lobe and inferior lobe. This is the oblique fissure, this is the oblique fissure, and just the right one has the horizontal fissure. Hilum pulmonis, radix pulmonaris, and bronchus. The hilum pulmonis are situated downward of the tracheal bifurcation, or carina, also called. The right bronchus goes down sharper than the left. The right primary bronchus is broader and shorter than the left one, consists of 6 to 8 cartilaginous semicircles and 2 centimeters in transverse section. The left bronchus is narrower and longer than the right one, and it consists of 9 to 12 cartilaginous semicircles. Like when we're choking with some food or something like that, it's more often it goes from the right one because it's broader than the left one and like it's straighter. So the food usually goes through the right bronchus. We have in here different structures, bronchus principalis, and then divided into lobaris superior, sinister, and lobaris inferior, sinister. Then we have bronchus lobaris superior dexter, bronchus principalis, that will be this one in here. This is principalis. We have bronchus lobaris medium, dexter, bronchus lobaris inferior, dexter, trachea, and carina. Ileum references. The following structures are found in each ileum. We have principal bronchus, pulmonary artery, 2 pulmonary veins, bronchial vessels, pulmonary autonomic plexus, lymph nodes and vessels, and connective tissue. And we have some structures related to each ileum of surgical importance. Anteriorly, the pericardiophrenik vessels, phrenic nerve, and anterior pulmonary plexuses. Inferiorly, it is the pulmonary ligament. Posteriorly are the posterior pulmonary plexus and vagus nerve, that is the main nerve that innervates the lungs. Hilum pulmonaris, radix pulmonaris is the cellular tissue surrounding the elements of the root lung. Its height is in average by 5.6 to 6.6 centimeters, and it corresponds to the level of T5 and T4. Hilum pulmonis, radix pulmonaris. The elements of the roots of the right and left lung are situated asymmetrically. In the root of the right lung, the supreme position is taken by the primary bronchus, pulmonary artery, inferior pulmonary veins, and inferior pulmonary vein, superior and inferior. So, main bronchus, right pulmonary artery, right inferior pulmonary vein, right superior pulmonary vein, and of course plexuses. We have also the apex of the lung. We have the superior lobe, middle lobe, inferior lobe. We have this is the ilium, the ligamentum pulmonalis. We have the oblique fissures, and horizontal one, horizontal oblique. Sclerotopy. The right lung adjoins by the mediastinal surface of the lung to the atrium. Posterior of the ilium pulmonis, the lung adjoins to the azygos vein, bodies of the thoracic vertebra, and to the 2/3 of the esophagus, making the esophageal group. The root of the right lung circumflexes the vein azygos from behind forward. Syncope. Posterior of the ilium pulmonis, the mediastinal surface of the left lung adjoins to the thoracic aorta, which makes an aortal groove on it. The root of the left lung is circumflexed from the front backward by the aortic arch. So we will see that we have the aortic groove, we have the esophageal groove, because the aorta is attached to the lung, and it also helps in the blood supply of it. Lingula pulmonis sinistra. The oblique fissure of the right lung goes the same as in the left one. In the place where fissura obliqua crosses the mid-axillary line, the fissura horizontally traces almost horizontally to the fourth costal cartilage, attaches to the sternum. So it's like a tongue. That's why it's called lingula, because it means tongue in Latin. Blood supply of the lungs. The lungs receive dual blood supply from the systemic and pulmonary circulations. Systemic circulation is supplied by the bronchial arteries and branches of the intercostal trunk on the right side, and in the left side is from the descending thoracic aorta. Pulmonary circulation is delivered by the pulmonary arteries. They are branches of the pulmonary trunk arising from the right ventricle of the heart. In the pulmonary circuits, we have the right pulmonary artery, left pulmonary artery. We have right pulmonary veins, left pulmonary veins. We have also aorta. Here we have right atrium, right ventricle. We have left atrium, left ventricle. That's the pulmonary circuit. And bronchial artery, we have some structures like the esophagus, we have the arch of aorta, from where the left superior intercostal artery goes out, and also the bronchial arteries. One for the left and two for the right. This is the right superior posterior intercostal artery and left superior intercostal artery. Blood supply of the lungs. The pulmonary arteries deliver low pressure deoxygenated blood to the lungs. The bronchial arteries deliver oxygenated blood at the high pressure to the organ and its supporting elements. As I said, 2 vessels on the left and 1 on the right. And then 1 and 2. This is 1 that divides into the right bronchial artery and divides also in the intercostal artery. The right bronchial artery arises from the intercostal bronchial trunk. On the left-hand side, the bronchial arteries are direct branches of the thoracic aorta. Irrigation of the lungs is carried by the bronchial arteries, arteria bronchioles, branching from the thoracic aorta. In lungs, they follow the passage of the bronchi. The pulmonary arteries and veins function as blood oxygenators and are nutrient only for the terminal alveoli. So, this is a remarkable feature that just the alveoli are supplied for the pulmonary arteries. The other parts of the lung are supplied by these arteria bronchioles branching for the thoracic aorta. The oxygenated blood gets into the left atrium through the pulmonary veins. The venous blood flows off from the tissue of the lung, bronchi, and large vessels along the bronchial veins, which follow into the vena cava superior network through the vena azygos and vena hemiazygos. So those are variation in the bronchial arteries. As we saw, the bronchial arteries arise from the thoracic aorta, and they can be like 1 and of course 2, 2, 2, 2, 2. And those are bronchial veins, azygos, this is the trachea, left main bronchus, right main bronchus, accessory hemiazygos accessory. The venous drainage is also divided into systemic and pulmonary circuits. Bronchial and pulmonary veins drain blood from the lungs. The bronchial veins drain to the hemiazygos or azygos system. The pulmonary veins return directly to the left atrium of the aorta. So let's recognize some structures. We have carina, trachea, main bronchus, that then is divided into lobes. We have the superior vena cava, we have azygos vein, then hemiazygos and accessoria hemiazygos vein. We have superior lobe bronchus, main bronchus, superior lobe bronchus, then middle lobe bronchus, inferior lobe bronchus, and the left one is quite longer. This is the main bronchus. Then it divides into superior lobe and inferior lobe. Venous drainage. In lungs, there are venous capillaries that are inside the alveolar walls. These capillaries join together to form large veins. These veins are grouped in different levels. First, into segmental veins. So we have, first of all, capillaries. Venous capillaries. Then we have that they are grouped into different levels and become first into segmental veins. They collect blood from each segment of the lung, and then they become lobar veins. From each lobar veins. They collect blood from several segments in a lung node. And finally, they become pulmonary veins that are the main ones. Pulmonary veins. On the right side of the heart, there are 3 lobar veins that merge into 2 pulmonary veins. And in the left side, there are only 2 lobar veins that also merge into 2 pulmonary veins. So we have, in the right side, there will be, because we have 3 lobules. So 2, that's a long. So we have 1, 2, and 3 lobar veins that then becomes into just 2. Let's imagine that this is the ileum, but like this. And in the left one, we just have just 2 because there are 2 lobes and they become into 2 veins, pulmonary veins. The innervation. The pulmonary plexus is an autonomic plexus formed by pulmonary branches of the vagus nerve and sympathetic trunk. The autonomic nervous system is responsible for dilating and constricting the airways and for regulating bronchial secretions. Pulmonary plexus, those are branches from the vagus nerve and sympathetic branches from the cervical cardiac nerves. It is subdivided into anterior and posterior divisions according to its relationship with the ileum of lung. It also innervates the visceral pleura, because we know that visceral pleura is attached to the lung, so they have the same innervation. We cannot remove visceral pleura without damaging the lung. So it makes sense. The lymph drainage. The lymph vessels that drain the lungs originate below the pleura and are referred to as the subpleural plexus. This group of vessels is further divided into superficial and deep groups. This is the ileum. In here it has to be. And those are like the superficial nodes, and from here they goes like the deep. So the deep ones are more near, just like near to the alveolus, and the superficial are in the ileum. In here we have the roads of drainage. The right lung, all lobes drain to the pulmonary and bronchopulmonary nodes, and then to the inferior tracheobronchial carinal nodes. And in the left lung, we have the superior lobe drains to the pulmonary and bronchopulmonary ileal nodes, and inferior tracheobronchial cardinal nodes. Cardinal nodes because of cardinal. The left inferior lobe drains also to pulmonary and bronchopulmonary ileal nodes and to the inferior tracheobronchial carinal nodes, but then mostly to the right superior tracheobronchial nodes, where it follows same road as lymph from right lung. So let's recognize some structures. Those will be the bronchopulmonary ileal nodes. Bronchopulmonary ileal from ileum, because they are here. We have also the pulmonary intrapulmonary nodes because they are entering already in the lung. We have bronchopulmonary ileal lungs from the left lung, and pulmonary intrapulmonary lungs and nodes, from the left lung. In here we have interlobular lymph vessels. Interlobular because they are inside of each lobule. Interlobular vessels. Okay, right here we have the right lymphatic duct and the bronchomediastinal lymphatic trunk. So bronchomediastinal lymphatic trunk that then divides into the right lymphatic lung. Duct. Subclavian and vena subclavia and subclavian lymphatic trunk. We know that then they goes for the arm to supply in here the lymph nodes, because we have also accumulation of nodes in the axillary fossa, and some from the breast. Right paratracheal nodes, because they are, so this is the trachea, and everything that it's like laterally goes to parasagittal, paratracheal, parasternalis, linea parasternalis, goes like that. And that's it. In here we have also another picture. We can recognize the vagus nerve. We can recognize the superior lobe, the middle lobe, and the inferior lobe. Means that is right lung. We have in here superior lobe of the left lung, but it's also covered by the pleura, so we cannot see the separation. Left lung. Okay, we have in here the heart covered by pericardium. We have the right atrium. We have the ventricle is covered by fat, so we cannot see the separation correctly. We have the arch of aorta. We have the superior vena cava. We have the left brachiocephalic vein. We have the right subclavian vein and glandula thyroides, internal jugular vein, of course, and diaphragm. So let's start with the bronchopulmonary segments of the lung. This is the basic summary of bronchopulmonary segments. We have a total of bronchopulmonary segments, 10 on the right and 8 to 10 on the left. Then number of segments in the superior lobe, we have already 3 on the right, 4 on the left. Number of the segments in the superior lobe, that are 2. Number of the segments in the inferior lobe, 5 on the right and 4 on the left. Here, this is the trachea and bronchi. We can recognize the trachea. We can recognize tracheal cartilages. Okay, this is the mucosa of posterior wall of the trachea, because it's covered by mucosa. Superior lobar bronchus, superior lobar. Okay, let's start. This is carina, main bronchi, superior lobar, middle lobar, and inferior lobar. We have main bronchus, the superior division, then lingular bronchus and superior division. Pulmonary segments. Each lung consists of 10 segments, 3 pulmonary segments in the superior, 2 in the middle lobe of the right lung, and 5 in the inferior lobes. So 3 to 5, 3 to 5, 3 to 5. Okay, right bronchopulmonary segments. The pulmonary lobe of the right lung has 3 pulmonary segments. Apical segment S1, posterior segment S2, and anterior segment S3. Is limited inferiorly by the horizontal fissures. Horizontal fissure, this one, and we have 3, S1, S2, and S3. Apical segment, apical segment, posterior segment, apical because it's the most superior part. We have also anterior segment, and this is just the superior lobe. 1, 2, 3. Right bronchopulmonary segments. So the middle has just 2 segments. Medial segment, we will have 5 and 4. 5 medial segment and the lateral bronchopulmonary segment. Lateral bronchopulmonary segment. Right bronchopulmonary segments. The inferior lobe of the right lung has 5 pulmonary segments. The superior segment is 6. The medial basal segment is 7. It lies below the hilum. The posterior basal segment is 10. The lateral basal segment is 9. And the anterior basal segment is 8. So let's begin from the first. The superior segment is 6. So superior segment is 6. Is 6. Superior segment, superior segment. Then medial basal segment, it lies below the hilum, so hilum segment, medial basal segment, hilum below, so we cannot see in the anterior view, costal view. The posterior basal segment, posterior basal segment is 10. The lateral basal segment is 9. Lateral basal segment is 9. And the anterior basal segment is 8. Anterior basal segment, anterior basal segment. Yes. Left bronchopulmonary segments. In the superior lobe, we will have 4 pulmonary segments that will be apico-posterior segment, anterior segment, superior lingular segment, and inferior lingular segment. We will see that the apico-posterior segment will be fusionated by one and the second S. So this is the first one with the second, that they will be apico-posterior segments. The anterior segment, or S3, we will see in here, in the middle part, practically. This forms just one segment. The fourth segment, superior lingular segment, will be this one, superior lingular segment. And the inferior lingular segment, or S5, will be in here. Inferior lingular segment. Left bronchopulmonary segments. The inferior lobe contains 4 bronchopulmonary segments. First, superior segment of the left lung, anteromedial basal segment of the left lung, lateral basal segment of the left lung, and posterior basal segment. Superior segment. This one. We have lateral basal segment of the lung, lateral basal segment, 9, lateral basal, posterobasal segment, posterobasal segment, that will be the 10th. So those are. We have then, in the left, we have just 8 bronchopulmonary segments, and in the right we will have 10 segments. Bronchopulmonary segments. So let's learn them by heart. Let's remember them by heart. APA, LMSM, ALP. Apical, posterior, anterior, lateral, medial, superior, medial basal, anterobasal, lateral basal, posterior basal. And in the left bronchopulmonary segments, we have AS, ALPS. Apicoposterior, superior lingular, inferior lingular, anterior, anteromedial basal, lateral basal, posterior basal, superior basal. So, the right lung, we have apical, posterior, anterior. In the middle lobe, lateral, medial. Inferior lobe, superior, anterior basal, lateral basal. In the left lung, we have superior, apicoposterior, that we know that is the fusion of the S1 and S2, segment 1 and segment 2, superior division. So, apicoposterior, anterior, superior, inferior. And then in the inferior, we have also for superior, anteromedial basal, lateral basal. In here, the mediastinal view. Apical, superior lobe of the right lung. Apical, posterior, anterior, middle, medial. And inferior, superior, medial basal, anterior basal, lateral basal, and posterior basal. In the left lung, we also see apicoposterior, that is the combination of segment 1 and segment 2. Anterior S3, superior S4, inferior S5. And in the inferior lobe, we have superior, anteromedial basal, lateral basal, posterior basal. From the right primary bronchus before entering the ileum pulmonis, the proximal secondary bronchus splits off. It divides into 3 segmentary bronchi, 1, 2, and 3. The mid-lobar bronchus splits off. The primary bronchus is called intermediate. The mid-lobar bronchus splits into 2 segmentary bronchi, 4 and 5. After branching of the mid-lobar bronchus, the intermediate bronchus passes on us as the distal one, which divides into 5 segments. 6, 7, 8, 9, and 10. The left main bronchus splits into the superior and inferior lobar, proximal and distal bronchi. In the ileum pulmonis, the proximal bronchus divides into two trunks, the superior to the 1 and 2 and 3 segments, and the inferior or lingular, which divides into 4 and 5 segmental bronchi. From the distal bronchus, a segmentary bronchus branches of the superior 6th segment to the inferior lobe. Further, the distal bronchus goes on as the basal bronchus, which divides into segmental bronchi, 7th inconstant bronchi, 8 and 9 and 10. So this is the alveolar tree. We have the trachea, that then trachea, it divides into main principal bronchus, and then it will be the superior and inferior bronchus or lobar bronchus. We have also the segmental bronchus, 3rd and 4th generation. Then we have the subsequent bronchus, 5th and 11th generation, and bronchioles. So we have first the primary bronchus, then lobar bronchus, 2nd generation, then 3 segmental bronchus. We have then subsegmental bronchus and bronchioles. So main bronchus, lobar, segmental, subsegmental, bronchiole. And in the 16th generation, we have the terminal bronchiole, that is just this part, and it goes the respiratory bronchiole, that is where the gas exchange begins, and the alveolar sac. So this alveolar sac also will be covered by capillaries, venosus capillaris, and capillaris arteriosus for the gas exchange. And also in here we will have like lymph capillaries that are quite small. They help to protect. We have cartilage rings, root of lung. We have this. So in here will be the helium. That's why it's called root of lung. Visceral pleura, because it covers the lung. So primary bronchus first, then secondary bronchus, tertiary bronchus, smaller bronchi, bronchioles, terminal and respiratory, and then alveoli. Secondary bronchus also can be named as lobar. So in here are the bronchopulmonary segments. We will see that they have itself like color. We have different colors that can us to determine which part they are, and we can draw the lung. The inferior. You see. The irrigation of the lung. The right pulmonary artery divides into lobar and segmentary arteries. At the level of their branching off, don't always coincide with the levels of branching. The pulmonary veins, superior and inferior, are made from the segmentary and central veins. The inferior pulmonary vein is shorter than the superior one and is situated backward and downward of here. We have some structures that are important in here. So let's remember. That's the main bronchus, left pulmonary artery is the left pulmonary veins, superior and inferior. We have, this is the helium, pulmonary ligament. We have, this is the diaphragmatic surface, lingula, inferior border, we have the oblique fissure, we have superior lobe, and inferior lobe, divided by the oblique fissure. We have the groove of the left brachiocephalic vein, groove of subclavian vein, and area for the trachea and esophagus. Here. In the right lung, we also have different groups. We have the same structures in the helium, but we can see the group of azygos vein. We can see here the group of brachiocephalic vein. We can see the group of the first rib that is in the costal surface, the area for the trachea, the area for the esophagus, also we can see the group of esophagus. Group for esophagus. Yeah, the pulmonary ligament. And we have the fissures. This fissure, fissura obliqua and fissura horizontalis. In the trachea, we have the segments that we already talked: apical, posterior, anterior, lateral media, anterobasal, anterolateral, posterior, apical, posterior, anterior, lateral medial, anterobasal, anteromedial basal y lateral basal, posterobasal, medial basal superior. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, apical. And that's all. Thank you for the attention, and I hope this information will be useful for you and your exams. Bye bye.